What is posterior cortical atrophy? Posterior cortical atrophy, or PCA, is a progressive degenerative condition involving the loss and dysfunction of brain cells, particularly at the back or posterior of the brain. In the vast majority of cases, this loss of brain cells is associated with the same pathological brain changes seen in typical Alzheimer's disease, namely amyloid plaques and neurofibrillary tangles. In other words, PCA is most usually considered to be an unusual or atypical variant of Alzheimer's disease. Despite being caused by the same disease process, the effects of PCA and typical AD upon the behavior, thought processes and skills of individuals with each condition are very different. Typical AD is most commonly associated with deterioration in memory, language, perception, and a host of other skills and abilities. By contrast, individuals with PCA tend to have well-preserved memory and language, but instead show a progressive, dramatic, and relatively selective decline in vision and/or literacy skills such as spelling, writing, and arithmetic. The reason for this marked distinction between PCA and typical Alzheimer's disease is that the distribution of the disease in the brain is different. In typical Alzheimer's disease, disease-related changes are evident across most brain areas, whereas in PCA, the changes are restricted to or focused upon the rear of the brain, and so initially only the skills which those brain areas normally support are affected. Considering the symptoms of PCA in more detail, the most common problem first noticed by individuals with PCA is with vision. Quite understandably, this leads many people to consult their optician, but in fact the visual problems experienced are not related to the eye. Rather, the problems stem from the difficulty the affected brain has with interpreting the information sent to it by the healthy eyes. The precise nature of the visual problems experienced may vary widely, but often include some or all of the following. Difficulty recognizing objects in pictures, for example, household items in a catalogue, especially if the pictures were taken from obscure angles or if the picture is incomplete. Difficulties recognizing faces, for example, television characters, friends, and relatives. Difficulties appreciating the spatial location of objects around them, for example, missing when reaching out to pick something up, or finding it hard to press the correct numbers on a telephone, or not seeing something that you are looking for when it is right in front of you. Difficulties judging distances, for example when driving or descending the stairs. Increased difficulty judging the speed of moving items, such as traffic. Perceiving movement among things which are stationary. Getting lost when trying to read a book or newspaper, causing one to miss some lines of text or to read others twice. Finding that letters appear to move around or become superimposed over one another when reading. Finding certain types of text harder to read, for example large print, like in newspaper headlines, and also handwritten notes. Experiencing objects as having an unusual colour. Being increasingly sensitive to bright light or shiny surfaces. Experiencing double vision. Or feeling that one's eyes are jerking around or not completely under one's control. However, vision is not the primary or only area of difficulty for everyone with PCA. Skills such as literacy, numeracy, and the ability to make skilled movements may also be affected. Such difficulties may be experienced in the following ways. Problems recalling the exact spelling of words. Difficulties with handwriting. Difficulties with remembering the shape or name of particular letters or numbers. Slowness and difficulty with mental arithmetic. Problems dealing with money and small change. Awkwardness making gestures, for example waving or the thumbs up gesture. difficulties with using particular tools, kitchenware or implements, such as cutlery, scissors or glasses. Problems with dressing and clothing, which may be partly related to difficulties with visual perception. PCA can affect people in different ways initially. In some instances, the disease affects both sides of the brain equally, leading to a combination of many of the symptoms described above. For other people, the disease may affect one particular brain area earlier or more significantly. As a result, problems with spelling and writing, for example, might be the first sign of the condition, with vision relatively unaffected, whereas for others, difficulties in seeing where objects are might be the initial symptom. Diagnosing PCA. PCA tends to affect people at a somewhat earlier age than typical AD, with individuals often being in their mid-50s or early 60s at the time of their first symptoms. However, it can also affect older people. The onset of the problems is usually insidious, with subtle symptoms which may be difficult for the person experiencing them to explain. Individuals with early visual complaints are typically referred to opticians and eye specialists before referral to a neurologist. However, it should be noted that visual deficits are not the only presenting feature in individuals with PCA, as selective problems with spelling, which is called agraphia, numeracy, known as acalculia, and learned motor skills, referred to as apraxia, have also been reported. Even once an appropriate referral has been made, it may take some time before the diagnosis is made formally. Understandably, patients may feel frustrated by the time of diagnosis, typically 1 to 3 years from the onset of symptoms. As noted above, the underlying cause of PCA in the majority of cases is abnormal alterations to brain cells, similar to what is seen under the microscope in Alzheimer's disease. However, a small number of other conditions can result in similar symptoms, at least initially. These include dementia with Lewy bodies, where individuals may also experience visual hallucinations and may become stiff and slow down in their movements, in a similar manner to people with Parkinson's disease. Corticobasal degeneration, where individuals may have difficulty using one side of their body. Sometimes they have difficulty controlling the movement of one arm, which seems to move on its own as if it had a mind of its own. This is known as the alien limb phenomenon. And finally, prion diseases, such as Creutzfeldt-Jakob disease. Very rare conditions in which individuals may rapidly decline in their cognition and develop other problems such as jerking movements of their limbs, known as myoclonus, stiffness, loss of balance control, and the development of seizures. There is no diagnostic test for PCA. However, tests such as specialized visual tests, organized by eye specialists, neuropsychological tests of cognitive skills, such as memory, perception, and literacy, blood tests, brain scans, such as MRI or CT, lumbar puncture, which is examination of the fluid circulating around the brain and spinal cord, and EEG, or electroencephalogram, which is a recording of the electrical activities of the brain, may all help to exclude potentially treatable causes of the condition, such as infection, inflammation, or brain tumors. The shrinkage at the back part of the brain as a result of brain cell loss may be visible on the brain scan. It may be difficult to come up with one diagnosis in life, and a definitive diagnosis can only be made once brain tissue is examined by the pathologist. PCA is a rare condition, but its exact prevalence in the normal population is currently unknown.